Femur is the longest and strongest bone of the body. It forms the skeleton of the thigh and is about 45 centimeters long. It forms the hip joint at the upper end and knee joint at the lower end. Femur comprises upper end, shaft and a lower end. The upper end consists of a rounded head directed upwards, medially and forwards. It contains a fossa or a fovea. It is followed by a neck and a greater trochanter and a lesser trochanter. Neck is limited anteriorly by the intertrochanteric line and posteriorly by intertrochanteric crest containing a quadrate tubercle in the middle. Neck makes an angle of 125 degree with the shaft. The neck makes an angle of 125 degree with the shaft. This line shows the long axis of femur. The other line shows the long axis of neck, and the angle made between the two is 125 degrees. The angle is less in the female because the femora are more oblique as the pelvis is wide. Neck comprises an upper border and a lower concave border. This concave border is strengthened by a thickening of bone called the calcar femoral. The lesser trochanter. This is a traction epiphysis on the medial and posterior aspect of the neck. The greater trochanter. This is also a traction epiphysis. It consists of an anterior surface, a lateral surface crossed by an oblique ridge, medial surface with a deep trochanteric fossa, and an upper border with an apex. Shaft is the longest part of the bone. It is convex anteriorly. It comprises three surfaces in the middle. These are convex anterior, medial and lateral. The borders are ill-defined medial and lateral borders. The posterior border is called linea aspera. This is a prominent border and it has lateral and medial lips. In the upper 1/3, there is an additional posterior surface. Lateral part of posterior surface contains a prominent gluteal tuberosity. In lower 1/4 also, there is an additional posterior surface called the popliteal surface. Along its medial border is medial supracondylar ridge and an adductor tubercle. Along lateral border of popliteal surface is lateral supracondylar ridge. The lower end comprises two large condyles. Lateral condyle is more in line with the shaft. Medial condyle is larger and is placed at an angle to the shaft. The condyles are united in front but are separated by an intercondylar notch posteriorly. On the lateral surface of lateral condyle is a lateral epicondyle. Below the epicondyle is a groove, the popliteal groove. A muscular impression is present on the posterior superior surface of lateral epicondyle. Medial condyle. The medial condyle on its medial surface shows a pointed projection, the medial epicondyle. Posterior superior to medial epicondyle is the adductor tubercle. The articular surface of the two condyles are divided into patellar and tibial parts. The patellar surface extends more on the lateral condyle. Tibial surfaces cover the inferior and posterior surfaces of both condyles. The site identification. Head is above and larger lower end is below. The lower end is medial compared to the upper end. The bone is placed obliquely. The greater trochanter is laterally placed in the upper part. Convex surface of the shaft is anteriorly placed. Attachments. The head is intracapsular, forms the stable hip joint. Attached to the fossa is ligamentum teres or round ligament of head of femur. Its other attachment is to the acetabular notch of hip bone. The capsule of hip joint. The capsule of hip joint is attached to the whole of anterior intertrochanteric line and halfway between the margin of the head and the intertrochanteric crest posteriorly. The quadrate tubercle on the intertrochanteric crest gives insertion to an unimportant quadratus femoris muscle.